scoped and I started to ask questions like, what is help, right? Like, how do I really help that individual? And am I getting in the way? You know, and as you guys as clinicians and healthcare providers, right? Like, you've got to do what's best for the patient. And I think we see that in the healthcare industry, but do we see that sometimes in the human service industry? Do we say, what's the best for that person in front of me? That's the question we want to ask, right?
Welcome to In Good Company.
Jason Hynson is the Executive Director of Victory Mission and Ministry in Springfield, Missouri, a faith-driven organization focusing on helping individuals overcome poverty and homelessness through emergency relief, recovery programs, and long-term empowerment. Since 2016, he has helped lead initiatives that provide shelter, job training, and social enterprise opportunities to help people rebuild their lives and regain independence. Passionate about helping others discover their purpose, Jason believes every life has value and that with the right support, anyone can move toward a better future. Jason, welcome to our podcast.
Hey, man, I'm glad to be here. I put a we in there. But it's just, y'all are the we, I'm the me.
Everyone and it supports you. Well, the Victory Mission has a super long history. It started in the 70s. It's come a long way from handing out sandwiches out of the back of a station wagon.
That's right.
Tell me where you're at today.
Yeah, man, we are on the cusp of the next 50 years, right? We're in our 50 year, we're calling it the year of Jubilee, just celebrating all the lives we've helped, all the people we've helped. And then now, you know, we're building also a 50,000 square foot building, new headquarters, expanding our sheltering opportunities. And in that building, there's essentially 3 different programs. We have an emergency shelter, transitional shelter, long-term programming, new offices. I like to say we're going to be like the junior college of the homeless space. We're going to, you know, just have people walk in and like, hey, where do you want to be a year from now, 2 years from now? What kind of business do you want to start? And just let people dream. I think that's what we maybe do or want to do the best in the community. So, yeah.
You have an amazing reputation, and I know other cities handle homelessness differently. How is your philosophy different than some other cities?
I think there's almost 2 philosophies of like helping people, right? We see the need and then we want to do something about it. We want to say, hey, I can help you with, like, where Victory started. It was like this idea of like, hey, there's somebody downtown, they're hungry. In Springfield, hey, let's give them some coffee. Let's give them a sandwich. Let's, pray with them. Let's have a conversation about, maybe where they are. And then I think what we've learned is now there's almost like this shift that happened where what I see is I can go into a company and I'm going to give them my email and I might get something for free. And so like all of a sudden there was this shift that happened in our brains that like people are giving things away. And if they're giving it away, I'll take it. And so the challenge we have is that if I'm giving out a sandwich, I might feed more than the people that really need it. And that's the tension that we're stuck in is we're saying, well, they need help, but I'm also, what if the best help is for them to maybe that pain to change, to motivate them to do the next thing and not just, am I accommodating their brokenness? Am I accommodating kind of that stuck feeling, that survival mode? And that's the question I started to ask of helping people in a lot of different varieties of, I've been in childcare. I worked for the Boy Scouts of America, which is now Scouting USA. I've worked for, a camp where we serve people of all ability levels coming from, medically fragile populations to kids just wanting to have a great time at camp to somebody who's a kid at heart, kid at developmental stage, but, is a grown, adult biologically, kind of body form. So like all these things that I've kind of scoped and I started to ask questions like, what is help, right? Like, how do I really help that individual? And am I getting in the way? And as you guys as clinicians and healthcare providers, right? Like you've got to do what's best for the patient. And I think we see that in the healthcare industry, but do we see that sometimes in the human service industry? Do we say, what's the best for that person in front of me? That's the question we want to ask, right?
Beautifully said, finding a balance between help and enablement. That sort of thing is, I think, a big challenge. And, I think you could debate that all day long, but you guys do such amazing work. Tell me a little bit about the statistics of homelessness in Springfield or in Southwest Missouri.
Yeah, we're pushing probably 2,500 to 3,000 people. I mean, it's hard to quantify that. The federal government, with a lot of the funding that comes through, they do a point in time count where they, every January they count people in the shelters, people in the streets. They go to camps. But I think those are like maybe I like to say the visible homeless. There's probably the couch surfers, people staying with their friends, people staying in their cars. And there's a level of pride still with that. Like, I'm not going to let you count me homeless. Like, I'm just, I've just got a momentary lapse. Like, I'm living in my car. And then you ask the next question, like, because I feel like we want to be people that ask the next question. Like, well, tell me how long you've been living in your car. 3 years, or something like that. Then it's like, well, yeah, but they're still working. You've got this working poor mentality. Then you've got the chronic homelessness that we sort of associate with homelessness. So all these things are happening out there. So how do you quantify that? But I mean, I think what we're seeing is a growing number. I think when we try to do what I've seen, when we try to do day shelters, when we try to do empowerment, like we're trying to say, hey, we're going to empower these people. What we really do is we just start like congregating them, because what I've noticed in this community is people who are experiencing homelessness, there's a community there, right? There's kind of this subculture where, yeah, I might be experiencing homelessness, but I'm also the guy who can get things, or the girl that like, I know how to help you, And so now my identity is wrapped up in that kind of identity piece. And so it's an interesting dynamic to just understand it. So the statistics wise, we've got a lot of people homeless. I think we're also as a hub in kind of a growing urban area, we're congregating people here because the services are here. So when people say, well, if there weren't all these nonprofits here, then people wouldn't come. They're still going to come. There are services, there are day shelters, there are things that are being going. So are we congregating them? Yes. And where else would they go? I mean, they're going to come here. There's jobs, there's opportunities. There's like when I was in childcare, we used to call it the geographical cure. Well, if I could just move over there, it'll change. If I could just get a new house, I need a new apartment. We think the things around us are going to change, and then we end up with the same circumstances and go, maybe the only continuity piece there was me. Maybe I'm the one in crisis. So
yeah.
So I don't know if that answers your question.
No, it does, and I think I personally have a lot of ignorance around like how many of those people are women, how many of those people are children, how many of those people are over the age of 60,
Sure.
that sort of thing.
Yeah, and that's a great question. So I think with one of the things that I've noticed and what we've tried to do, we do not take any federal funding through the Housing and Urban Development, right? Or, that department, Housing and Urban Development, or HUD. Yes, the HUD people.
There you go.
They love acronyms, but I was trying to, so it's like Housing and Urban Department, the economic, director. But what we try to do is we try to realize we're on the opposite side. So because HUD funding has some very specific target points, and even veterans, right? Veterans Affairs, their greatest challenge is finding the veteran when their name gets called. So like if you're a veteran and, people will say, well, we got to get all those veterans off the street. Look, there's great programs for that. The Kitchen Inc. locally, they have the Home at Last program. We've got the Veterans Affairs right there on Republic Road. They're looking for these people. It's not, the problem is when they got funding ready for them, they can't find them. And a lot of times alcohol, the mental health crisis that they're experiencing, post-traumatic stress, all these things are happening and they're utilizing their form of medication, right? Usually alcohol, drugs. Right. And that's the problem. So they're not paying their phone bill. They can't find them. And you could go talk to the case managers at Veterans Affairs because they get this all the time. Well, why aren't you helping those veterans? Man, they're trying. Yeah. They're doing everything they can. And so what we've started to do is almost like to see the gaps in those funding programs and do the opposite, because we don't want to do what they're doing. They've got VASH vouchers and all these other acronyms. Everybody loves to throw around acronyms in the social service space. So what we've decided to do is, what if we just house that veteran? We help them stay sober. We are a drug and alcohol-free environment. We're helping them stay sober. And when their number gets called for housing and permanent supportive housing and things like that, then they're ready to answer the phone.
Yeah.
And then we can help them. And so we work with Veterans Affairs in that way. We work with the Home at Last program through the kitchen. And so the veterans got services there. With kids, if you are a single mom or single parent and you have kids, there's a program for that, right? There's a lot of rapid rehousing. There's all these other programs that they've been utilizing. So those are there. Like, they're ready to house you if you have kids. If you're a male and you are experiencing how it's almost like you're just like, yeah, you're fine. Like, go get a job, right? And I think look, I'll just be honest. I remember being ignorant of that, and I'd pull up and I see somebody and I'm like, man, they got to get a job, you know? But now what I've realized is there's this thing called trauma. I was in childcare, and I realized every kid that was in childcare that I was at this boys ranch out in Texas, I realized here's the thing. Without the supportive family environments, if I'm coming out of foster care and I'm just angry at the world because the world has just sort of let me down, man, I honestly, I don't stand a chance. And that's the piece that we want to jump into is, you know, you can work, you want to work, you just don't know how. Everybody who was supposed to be a supportive relationship with you has let you down, betrayed you, hurt you, even abused you through all these different assets and kind of ways. And so that's our people, right? Mm-hmm. I can work, I want to work, I just don't know how. And so maybe we help you with the mental health stuff. We help you with kind of like, hey, what does it mean now you're a father, right? What does that look like? Now you're a mom, you haven't seen your kids, you're coming out of prison, you want to be free of the life of addiction. You know, you're sick and tired of being sick and tired, all those things. Mm-hmm. That's where we're at. Yeah. And so I like to tell people, man, there's a lot of great supportive resources. We've kind of been a lay of the land. That's actually when I got there 10 years ago, our board said, go find out what everybody else is doing, and then let's not do that. Yeah. Let's do the other. And man, wouldn't it be great if more nonprofits, you know, I'm preaching to the choir. I think a lot of nonprofits are faced with, you know, like that struggle, right? Oh my gosh, funding is being cut. The Fed's doing something different. You know, we've got a different administration. They're sort of flipping the playbook over and around and upside down, and people are getting frustrated, and they're like, change is hard for anybody. Yeah. You know, organizations or individuals, right? Let's just be honest with that. Yeah. So yeah.
So where does the Victory Mission get most of its funding?
We are a crowd-funded organization. I would like to say, just for round number, 75% of what we do is individuals, businesses, faith-based organizations, institutions, things like that. And then about 25% is what I like to call we generate our own revenue. And we want to do more and more of that. We would love for our entity, and this is kind of where we go with job training and different avenues like that. We have a Equip Coffee that puts a woman in our long-term program to work. We are not roasting beans. We're not roasters, but we can package that coffee. We can deliver that coffee. We can run a small business, and we can teach somebody those aspects to be a great employee within our system at equipcoffee.com. Equip Coffee. This segment brought to you by Equip Coffee.
We'll put that in the show notes.
Yeah, there you go. So, but like those kind of things, we started to realize like people need training, because what I was working with a lot of individuals at SRC, you know, Jack Stack, Chrissy Shell, she was a panelist at our most recent Prayer and Coffee event that we had. And like what they need, they want employees. But like what I realized is I can't take somebody from the streets of Springfield, you know, we kind of dust them off a little bit. Maybe they're sober for the first 30 days of their life or recently. And then we're going to dump them in an SRC electrical program. Yeah. And we've did this. I mean, we had failures, right? And I think I'm not going to sit here and say everything's pie in the sky. Like, you know, you watch a movie, there's movies out there about somebody who was homeless and now they're like a business owner and they're doing, and we have those stories. We also have like, for every one of those, there's maybe 3 or 4 where we failed and they get sober, they get a job, they move out maybe, and then there's another toxic relationship that they're in and they realize, oh, that girl I'm with or that guy I'm with, oh, they're using, and they didn't tell me about that because nobody's ever, you know, like when did you meet somebody say, oh yeah, and I'm in a real struggle with alcohol right now.
Yeah.
Let me tell you about that in the first 5 minutes. You know, no, we're hiding those things because, well, I'll get to that next week, or, you know, I'm not drinking as like we have that cognitive dissonance. Isn't that what the psychologists say, right? We say, well, I'm not that bad, or I'm not as bad as that person, you know? And so we don't tell ourselves the truth, you know, and all those things are a struggle. And so that's what we're seeing. We needed to have more time with people. So we have Equip Coffee. We have the mattress contract with the city of Springfield. So if you recycle a mattress at Lone Pine Recycling Center, Franklin Recycling Center, you can go to Springfield mattressrecycling.com. We got that too. So we want to help you recycle mattresses because that's the right thing to do. We keep them out of the landfill. So that $20, you'd be like, that stinks, man. The city, you know, I'm paying taxes. Well, that $20 comes straight to Victory Mission. In fact, they help us pay for some of the trucking that we do to get those containers moved around. So the city of Springfield is not making money on those $20. They are sending that to Victory Mission. We're processing that. We're deconstructing that. We're taking out some metal and different things. So we're putting men to work in our warehouse by recycling some clothing from different thrift stores. We're recycling mattresses. We're putting those guys to work. And then we also charge our transitional shelter. They're paying nightly and weekly. So I like to tell that story because then people are like what? Well, like the person comes in and in 30 days, we get them a boot camp, right? We have this work ready boot camp. And then we hopefully get them a job. And then they transition to our transitional shelter. And then now they start paying into the system that supported them. And when I got there 10 years ago, I was like, there's no way this is working. And it kind of wasn't. We had to work some kinks out, right? We reduced the amount of time that was free. So it was like you could spend 90 days there for free. Well, you might quit your job for free 90 days, right? Save up a couple, you know, or you get on food stamps or something like that at Supplemental Nutrition Assistance Program.
Yeah, nice.
So I try to not use acronyms because nobody knows what those mean. And everybody's like food stamps. There's not stamps anymore. You're not going to the grocery store handing them stamps. It's all debit cards and stuff like that. But so we just want to help people find the best version of themselves. I love to say that because I can't give you my goals, you know, and in the same way with what you guys are doing in healthcare, right? That patient is unique and the challenges that they are presenting to your clients, you know, your staff team, they are so unique that you have to have an individualized plan for their palliative care, for all these things that you're trying to walk out with them, pain reduction, but also that dignity piece. I mean, we're in the same business, right? We get to know a person. We call them a client, we call them a guest, whatever we call them. And then we get to know their story. And then from there, we can create a plan with them for their best case scenario, their best case. And that's the beautiful thing of like what you guys are doing, what we're doing. And that's why we're sitting here having this conversation, because it really is about the individual. It's about empowerment and it's about dignity, right? Would you all agree?
Yeah, absolutely. 100%. And wow, you covered a lot of bases. So there's a little bit I want to circle back to unpack a little bit. So you talk about recovery and would you say that that's the primary reason for most of the homelessness in our area?
I like to say that it's where they are. It's not the underlying cause of that is trauma.
Sure.
And those, you know, those relationships that, you know, one of our counselors says it this way. He says, look, if trauma got you into that situation, the only thing, and broken relationships, the only way that's going to heal you is a healthy relationship. Right. So what we've got to remove all those other kind of, I want to say barriers, walls that you've put up This is a kind of anecdotal story, but I talked to a veteran who was trespassing on a property we owned, who was drunk at 10 o'clock in the morning. And he told me, listen, I'm a veteran. I don't need your help. And I said, sir, I don't want to be rude, but clearly you do. Right. Mm-hmm. And he had stayed at our shelter. Right. And he had cussed out our staff. And like, there's lines that we just can't. And so just that conversation, I remember that very clearly, in realizing that like he's totally unaware of the help he actually needs. Yeah. And there's this pride shame that he's battling within him, that I don't need anyone's help. And at the same time, I don't know how to be humble enough to receive the help that you want to give me. Yeah. And that man, that's a trap. And I don't think you can look at it any other way, but like, that's just a tragedy of the human experience that, man, there's so many people that would want to love to help him, to hear his story. Even veterans that have walked out his similar situation, like, the Warriors Journey locally, they help veterans all over the United States and globally. Kevin Weaver's doing a great job, and they want to connect them with another warrior connector, right? Somebody that's been in their shoes that can help them, same way you guys are doing that for people at the end of life, and those kind of things. So,
so I think sometimes, you see homeless, mm-hmm. and there's this kind of, that's them.
Yes.
And this is us.
Yeah.
And the path to homelessness sometimes is a little murky. Yeah. So we don't know really how somebody got in that. And we probably have some imaginative story that kind of plays out in our head. And maybe it is all substance abuse, but you've probably heard dozens and dozens of, more than that, probably, stories of how people got to homelessness. What are some examples?
Yeah, I think one most recently that's kind of hit me is a youth aging out of foster care. Mm-hmm. And there's KVC locally does a great job. Good Samaritans, Boys Ranch, they have some great programs as well. And so I think kids that, they've been in and out of this system that was supposed to help them and support them, and they just get bitter. Eventually you go from house to house and somebody who's supposed to help you, and it just isn't the right environment. Incarceration, another thing, people that start using drugs at 12, 14, 16, they start drinking, they start smoking cigarettes, marijuana, other things. And then, one of our restoration graduates at 17, a gift he got from a friend who sells methamphetamine. He's a Northside kid, Hillcrest graduate. Somebody gave him 15 bags of methamphetamine. Like, hey, this is a gift, right? For his birthday. Like, that's the stories out there. They're as wide and big as that, or somebody who loses their job and, they just don't know what else to do. I mean, we had an individual who had a PhD who was staying at our shelter, but he lost his job, marriage fell apart, and then you kind of just stop with the will to live. Mm-hmm. During COVID, I remember talking to a guy who just, his girlfriend kicked him out, but he drove to our shelter because he didn't know what else to go. And it was in the middle of this, this global pandemic. Hotels were freaking out and we were all freaking out. Remember that? There was a crisis. And I remember well, what got you here? And he's like, to be honest with you, my girlfriend just kicked me out and I didn't know where else to go. And I was like, oh, yeah. Okay. Thanks for your, so those stories are big. And one of the other things we really like to work, we want to be a home plan for our friends leaving incarceration, So as they come out of prison, we want to be that safe place to land. The federal government has a Alpha House locally, and they're like, I'm just going through all these nonprofits because literally our community is rich with resources. Yeah. And so you've got Alpha House for people leaving the federal penitentiary system, but what about Department of Corrections locally? There is nothing. And so we are home plans for those individuals that want to look, I've never been sober this long. And if I go back to mom and dad's house, or, if I go live with my friends and I reconnect with them, man, they're a mess. Just a lot of them will tell you that, I'm just going to be honest. I would use again. And I'd probably be stuck in that same cycle. And they're like, fourth time out of prison, I don't want to do that again. And those are the stories we also hear. So,
yeah.
And that's preventing another homeless situation. So, yeah.
So do you do marketing inside of prisons to actual prisoners?
We
Talk
do.
about your services?
Yeah, that's a great question. Like we have one of our chaplains goes to Fordland. We have another program that's in the prison called Broken and Beautiful, and they're in the women's prison. And that's how we're recruiting for our long-term women's program. So exactly right. Yeah, somebody's got to be in there. We also have a partnership with St. Louis University. They have a job train, essentially think they'll do video interview just like we're doing right now. They'll do a video interview with an inmate currently, and then before they get out, they get a whole slew. That was intentional. They get like this book of this whole slew of video interviews for employers. So they work with people, St. Louis, Columbia, Kansas City, and Springfield now. So we, when they're coming out of the Department of Corrections, they could at least have a job, or like within the first week or 2 weeks, they could have an in-person interview. So think about like a employer that's like, hey, yeah, because there's a lot of great resources. You can actually get paid as an employer to pay your employee like up to half. I think some of the programs that are coming through the state. So you pay half of their wages. They'll pay the other half for like up to 6 months. So those are great programs, just incentives to hire.
Yeah.
Because if you come out and you can't find a job and you can't pay your rent, now you're homeless, and the best thing you might do is start doing what you used to do, which may not be what got you into prison in the first place. So they're trying to really buffer the system to hopefully you keep that job and keep moving forward. Yeah.
Are there certain, if you're going to do a shout out to try to get business owners interested in this program, what kind of industries would you kind of point to? Yeah,
I think trade organizations, a lot of people have a lot of construction. They're already hiring most of them are already second chance employers. Trade, manufacturing, anybody that says, look, and I'll quote Jack Stack, look, I can train people to do what we need them to do. What I can't train them to do is show up on time, have a good attitude, and be teachable. Like that almost has to be your attitude.
Yeah.
Right. But I can put you in a training program where, hey, this is what I need you to do with this piece of tool now, or take apart this, alternator, or bore out this engine. We have a lot of guys right now that are in our long-term program that are working at SRC heavy duty because one of our board members and former graduates, he has lived experience. And now is remarried his ex-wife. He's built a house with her. Like his whole life is, I like to say, I grew up in Oklahoma, so a lot of country, right? It's the reverse of the country song. So I remarried my ex-wife. The dog came back. The house has been built, stuff like that. And I'm driving a truck, and he does drive a truck. So it fits his story at least, yeah.
That's amazing.
Wow, it's fun.
Let me shift gears just a little bit. So I rarely share this story with very many people, but my mother had some mental health issues through her life, was very independent, let's put it that way. Smart lady. She had her master's degree in counseling, struggled with work most of her life. And then, I kind of lost a little bit of touch with her, couldn't find her, didn't hear from her, that sort of thing for a while. She was in her 60s when I found out that she was homeless out of her car. And I think she was down in Texas at the time. She kind of moved around quite a bit. But the road for her homelessness was related to her mental illness. That's and right. So she probably had times when she had substance abuse issues, but I don't know that it was primary. And so, but the path for her, she didn't become homeless until she was in her 60s. And I'm kind of curious if you've heard any of the stories from people who are kind of get in the older sectors moving into homelessness.
I think that's the largest group. And thanks for sharing that story, that, being very vulnerable with that. I think that leads into there are hundreds of people out there that there are family members looking for them, right? They want them to come home. They just can't come home in the way they last interacted with them. And I think you're exactly right. There are these underlying causes that we're seeing, either the drug challenges, the different alcohol, whatever it is, but under there's a hurt kid, there's a mental illness that if we could medicate, if we could help support them in that way, then, they could be a thriving, productive member of our society. And that's really what we want is, what I like to tell people when kind of the shock value we say is you're already paying probably $35,000 per person who's on the street through a variety of supportive tax programs, through your medical. If you've been to the ER lately, saddle up, right? You'll be there 8 hours, 6 to 8 hours. And that's because of just this burden of the frequent flyers. Somebody at Cox Health was telling me they've had people come in 4 times a week, just regulars. They know their name, and there's some mental health disorders that's happening there. So how do we help them? It's not in the crisis ER situation. It's got to be in a supportive program. There was an individual who had lost part of his leg. There's been a couple of those situations through some frostbite. And, I just like to think that, if we could get him in some housing, some shelter, like a program like ours, if we could get him back where he's eating good, he's resting well, he's not afraid to go to sleep, that somebody's going to come, try to steal his prescription medications or whatever else he's got. And we've had success. We had a guy who came during a crisis shelter, and he walked out on his own, had his own prosthetic. Like we sheltered him, we helped him. He had those resources. And so there's a path, but it takes that humility to say, hey, maybe you guys can help me. And, through sleeping well, eating well, using your things, showing up to your medical appointments, a lot of things can get better for them. Yeah. So
there's a lot of people out there that want to help.
Yes.
But sometimes, and I always tell my kids this, and you even mentioned it earlier, what is actually help? Yeah. And so the average person might be, well, I'll give the person standing next to my car $10 and that's my help. And I'm not deterring anybody from doing that. But in your opinion, what should the average person do to try to help with this problem?
I think it's a conversation, right? So if broken relationships are the reason they're there, then a good relationship may be the reason why they get out. And so I think that conversation, and I might even deter people from hey, maybe that cash isn't the best thing. I had a conversation with a guy I was taking to shelter, and the $5 that somebody gave him, that was well, I can get high with that $5, and so I don't want your shelter. That was literally what happened. He was in my car, we're driving to the shelter, and he's like, wait, I can't use marijuana there? I said, no. He's like, man, I'm not about to be in pain. And that means there's a whole lot more going on.
Yeah.
Right. And so in that moment, it's just that tension. So it needs a conversation, and local, the most simple form of help is probably the best thing, right? It's not they don't need a complicated story, but hey, what got you here? And you'll probably get the sob story that, and I need this. I'm just trying to get gas. I'm just trying, I really need some food. And last time I saw somebody most recently, because I now just look at, I'm trying to understand the dynamic. And I've pulled over people that I saw at our shelter that I've had conversations with that literally you get to the end of the conversation and we're having a hamburger or something, and they're just not ready. I think that's the best way to put it.
Yeah, they're not ready.
They're not ready.
Yeah.
But there could be a day when they are ready, and I hope they'll come to Victory Mission and say, hey, Jason saw me one day, and now I'm done. like, that's
Yeah.
that's what keeps me going. And it has, for me, it's my faith that I believe everyone's made in the image of God and that they have unique abilities and assets that we need in our community.
Absolutely.
Right. And that, like, by believing that, because otherwise, I'd get worn out and frustrated. And man, we had, the stories are endless in my head of the last 10 years, just thinking about there was that conversation, and man, he had a job and he's great. And then a month later, it's like we lost him. Like, we don't even, like, we don't know where he is. Like, phones are off. And you want to reach out to people, and it's heartbreaking.
Yeah. I think a lot of people, and I'm guilty of this too, that they don't realize how close people are to being homeless sometimes. And most families have somebody in their family that they really are just one bad thing away from things kind of falling apart. And that the distance between that homeless person and where you're at, sitting in your car or, in your office or whatever, is just not that far. And you think you are very, very different from that individual, but you're probably not as different as you think. And just a set of circumstances that happen to align that you're in this blessed situation where you have food and shelter and all of those things is, it's something that gives me pause for myself, because I think, gosh, how lucky am I day in and day out that, because it could have gone a different way. I've had situations in my own life where it could have gone a different way. And so I really appreciate you kind of shedding light on that for sure.
And I appreciate you guys. Like, I think these conversations we need to have, because the largest growing group of homelessness is 55 or older. Yeah. Because the Social Security, as we've all experienced, I was joking with somebody the other day. I love this butter, and it comes out of New Zealand. Well, it went up $3, right? So that butter went up $3. Now that fixed income person on Social Security, on a disability check, that's just really, that razor thin line you're talking about, if they crash through that wall, man, they're homeless now. And I think that's where we have to be creative in the solutions we help give people. That's one of the visions we have at Victory, is to be more on the housing side. We could also produce housing at maybe an easier rate, rather than paying more of a prevailing wage. We would have people that are leaving their past life, that have the trades that we could put to work. So we have all these visions. So, people that are curious about how we're doing it, man, I just say, come by, go to victorymission.com, check it out. Shoot us an email at info@victorymission.com. We'd love to have a conversation. Come see the shelter, because what we're trying to do is say, hey, there's got to be another path, because there's a lot of great resources out there. And if somebody has a nonprofit they love, then if you see that person homeless and your heart is tugged, man, get online right then, send $20 to your favorite nonprofit that's doing the work that you believe in and you're excited about, even if it's not Victory Mission, give it to somebody else, CPO, the kitchen, Crosslines is giving away great food. All these things are happening out there. So just fund some nonprofit and know you did the right thing. And when that person's ready, they'll find that resource, or pull over and have a conversation. Hey, what got you here today? Yeah. Could I eat a meal with you and hear your story? That's always been my thing. If I get I like to say trapped, where somebody says, hey, I need gas or something, hey, I'll have a conversation with you. I can sit down with you at Steak and Shake or Whataburger. I've done that, and just hear their story, and I'll eat with them. Right. Mm-hmm. Even if I already eaten, maybe have some fries. Because I think that's what's needed. Because you'll start to your BS meter will be going off, and you'll just be like, this feels like a story, or it feels very candid, or you get around to what's really going on. But you might even hear some of those challenges, hey, I have a degree, I have this, and you'll be surprised at what might have gotten them there. And I think that's just, if we see the people in our community. Hear their story and realize, man, they're not different as me. Yeah. Same.
Speaking of panhandlers, so it's a big problem around here, and giving cash may not be the solution. So what my church has done is we call them grace to go bags.
Yes.
And it's it's a 24-hour survival kit, toothbrush, wipes, things like that. But most importantly, we have a resource card that leads to Victory Mission and other nonprofits in the area where they can go and get the help that they need.
Yeah.
And you just spark that conversation right there on the side of the road.
Those are great. And I mean, those are wonderful. Just hand them kind of the give and go. Because one guy was like asking me for food. So he said food on sign, and I showed him this granola bar. And so he came over. I rolled down the window. I was like, I got this. He's like, actually, man, I really like a hot meal. And so he was like, can I just, and what he was saying was, that's fine, but I really need cash because I want a hot meal. And and then we had another conversation. I said, have you ever been to Victory Mission? I love asking that question because seriously, I have a backstage pass for that individual if I would get them in today.
Yeah.
Right. And what they don't know is I've got the ticket. You just hit the golden ticket if that's what you really want. And a lot of times I don't get yeses.
They're not ready.
They're not ready.
They're not ready.
And that's okay.
The beautiful thing, you mentioned failures earlier, but I was just thinking about this, is like once you give somebody the taste of the good life, it's hard to go back. Yeah. And even though they do go back, it eats at them, and so, I don't think it's a failure. I think it's just a step in the process, and sometimes you run out of time, but at the same time, there's still hope there. And that's what I hear from you, is there's so much hope there. One of the things I wanted to kind of zero in on, because this is kind of one of my biggest concerns, was we have this growing aging population and the growing aging homeless population. And, from a standpoint of somebody getting a job, it's not always possible when you get to a certain stage in your health situation. And unfortunately, some of these people don't actually live very long in those circumstances. And there's not enough beds to go around. There's not enough nursing home beds to go around, let alone anything else. And everything in between costs, like independent living, assisted living, that all is private pay. That's not something that Medicaid typically takes care of. So I guess from your standpoint, what are the signs of hope around that? And then what also are the big things that as a society we need to really put our weight behind in order to help this wave of people who could potentially, be at that stage where they don't have enough Social Security, they don't have enough support, they've got health issues that are climbing, they're aging rapidly because of the circumstances that they're in. Yeah.
I think that is a huge problem. And we want to address it in the sense that we'd love to have kind of that model where we could maybe build some housing because we're sheltering the guys. They're working minimum wage versus like a prevailing wage. But I think it has to be private. One of the things I'm kind of big on, more limited government, because I think that the challenge with that is the government's either on or off, right? You either qualify or you don't, right? And so what happens if you're sort of in the middle? I had a conversation with a guy who was helping me at my house, and he was an amputee with a motorcycle accident, and but couldn't get disability, and he also was running a forklift, and he was doing good things, or a bobcat, but I remember thinking you can't get and he said that I can't get disability. I only have one leg, and I'm thinking, I'm kind of with you, of all the things you would think, but I think those are the tension, because as your body ages, if you've been in the trades, now you're not as good. You can't handle that. That nail gun on the roof. You can't frame houses like you used to. You can't be in the, pouring concrete, finishing concrete like you once were. So those are all realities. And I think that's where we have to get to know them, shelter them, but then have a different avenue to where the Eden Village model is great. I love what Linda and David Brown are
Tell
doing.
everyone more about
Yeah,
that.
Eden Village is the tiny homes. They're taking people off the street with a disability or disability checks, Social Security. They're putting them in a tiny home. So then the margins are smaller on the front end, right? They're not building huge infrastructure. They're putting, and then what they do is they surround them with community. So it's the opposite. So what we do is we bring you into shelter. We give you community. We try to get to know you. They're getting them into a tiny home, and they're surrounding them with community, with church partners, with organizations that have sponsored those homes. Great, fantastic program, right? So it's private, right? It's all private dollars. It's those low barriers. We've got to figure out a different way than high rises, nursing homes. Because once you add a nurse, and you add all the infrastructure of that, you guys know, the cost just skyrockets, Yeah. So what if there was a way, and this would be a great thing, we need to work with hospice care, with these in and out nursing aides, the direct primary, if people don't know about direct primary care, where you could be the caregiver for that individual. Those are all amazing programs. And I knew about those with people that we were serving at Wonderland Camp when I was up there. The parents could be the caregiver. So they're already in the home. Mm-hmm. You have a child with, 24/7 needs. Like, the best and cheapest way for us as a community to have them is to have them in the home of origin. Mm-hmm. Right. And we need to keep having those conversations. And I think it stresses a lot of hospital systems out, and the Medicaid. And, I have Dr. Stinson's a friend of mine at Jordan Valley. Yeah. And we've just got to be creative in how we do that. And I see a lot of public-private partnerships to where we could do the housing at Victory, but then, Haven can do the assisted care, right? What if they just need a nurse's aide? Yeah. Right? Having the lowest form of intervention at the lowest cost helps all of us as a community. We've got to get creative about that, because you're exactly right. We cannot just have hospitalization. Our healthcare costs are going to go through the roof, and our federal government is getting very, big, and then states don't want to expand these things, and there's pushback, and so it just gets, I had somebody tell me, look at Veterans Affairs. There was a lot of challenges with that, and that's kind of the federally funded program. That maybe is not the solution. We don't need federally funded programming. We need privatized care that supports winners. Yeah. Right. Yeah. And so if you're winning and you're doing it at a great cost and you've got great culture, let's support those things. And that goes back to the government doesn't know how to be subjective, right? Yeah. Well, this is the only way we can do it. But if you're winning and you're crushing it as an organization, let's support winners. Yeah. And let's get them to get the care, because they're going to do it in a better way. So.
Yeah, there's tons of research out there that there's 5 pillars to keeping somebody in their home. And so the first thing is that their home's set up for them appropriately. That's right. They have to take their medications appropriately. They can't forget they take their medicine and take it 3 or 4 times, or they can't, forget to take it. They have to have good nutrition and hydration. They have to have some sort of exercise, and they cannot be socially isolated. If you get those 5 things put in place, you can keep people out of the hospital. You can keep them in their home. And, so we're trying our side of the street, trying to see if we can keep people out of a higher level care, higher cost. I mean, it's pennies on the dollar comparatively to higher cost of care. And so it feels like there's pieces of that as this aging population comes up that companies like ours and organizations like yours have to partner together and go, okay, what do we need to do to keep this person from having to go to the hospital every other day, from, needing all of these other services, and making right choices is obviously a big part, and being, taking accountability for your own actions, so to speak. But, I couldn't agree more. I think leaning on the federal government too much is probably not the answer, because it's just, there's a lot of failures in that. But at the same time, there's probably I think, a middle ground there that, like you said, paying for winners and not paying for not winners, for lack of a better way of putting it. And I really appreciate that very recently there's this push to say we're going to put a stop to fraud in home care and hospice and all this other stuff. I really advocate for there to be more inspection live, like there be somebody who's like coming in and looking for themselves. I think unfortunately that hasn't been in place for a long time. And that's something that I think will make a big difference.
You're exactly right. Those are the things we got to do, because you're seeing the challenges with some of these federally funded programs, right? I mean, that's where you're headed with
There's a lot of waste, unfortunately, but there's a lot of good that's there too. And so I don't want to throw the baby out with the bath, but at the same time, but if you're going to have, a privately supported organization, you have to have private support. And that's one of the reasons why we really wanted to have you on, is how can people best support the Victory Mission?
Yeah. And that's it. Like we would love your prayers for those individuals. We would love, your support, your volunteer hours. But like back to your point, I love where you're headed with keeping people. Those 5 pillars almost could work anywhere, right? Mm-hmm. How do we, and I think the basis of like having, hey, you've got a disability check, you've got Social Security income, so do you. You've been staying here. We create kind of matchmakers, and then we put them in a house together, and we have those systems in place. See, developers can't do that. If I'm a property manager, I can't do that.
Yeah.
I can't say, well, you guys, you look like you guys could be roommates together. You almost don't want that liability, because if something happens, but like on the nonprofit space, that's where we can house them for a season. We can get to know them. We can put them in, and we can hold them accountable to those things. That's where I think these conversations of like privatizing some of these other pieces and going back to what we used to do, where, I was listening to a book recently on like, in these farming communities, what they used to do, they would age in place, and they might be on a house in the same acreage, but they're in their house and they'll just check on them daily, or they'd be, they can't drive the tractor anymore, but there was like community, and we've lost all of that, and I think the mother-in-law quarters are coming back. What the city's trying to do with accessory dwelling units and apartments over the back, like we're trying to create housing that isn't single family or apartments, right? It's like, so how do we do like this mixed use and pocket neighborhoods? The Eden Village models are great. Branson's doing that with Elevate Branson. So I mean, there are opportunities out there. We just have to be creative and not just look like this is the only way to do everything. No, we got to be creative. And I think you guys are doing that here. You're innovating at Haven. We're going to continue to innovate at Victory too. So
you talked about healthcare partnerships and, Jordan Valley, and what other partnerships do you guys align with?
MSU Cares is a great program. The Jordan Valley program, like anytime we get people out, getting them a primary care physician is great. But I mean, we've had individuals that utilize oxygen in our shelter that are paying. That transitional shelter is a key in our community. So we work with Burl a lot now, Centerstone, I guess we have to say. So formerly Burl, the artist formerly known as Burl, Centerstone, they have great programs, and those are all, wonderful things. I like to tell people that, we're just we're one stop in the journey. We work with a lot of sober living programs too, individuals that come through our shelter that want to stay sober. There's other programs and churches that are doing great. They might have a recovery home, the Freeway Ministry Group out of Crossway Baptist. Like all of those are great avenues, and we're all fighting the same fight, right? If we could keep people sober, deal with those underlying issues, whether it's mental health, trauma, neglect, abuse, those kind of things that they're walking through, PTSD, veterans, then we can support our community. And I feel like we all win when, what do they always say? The rising tide lifts all ships.
Right.
And so like, just be aware, like that person needs your prayers. They need your conversation. They may, they need your bag, like you were saying with, like, hey, we're going to get them through. We're going to meet that immediate need, but in a very tangible way. It's a toothbrush, it's a wipe. And hopefully the pain to change, as my addiction counselor used to tell me, right? The pain to change has to be greater than the pain to stay the same. And that's true for all of us.
Yeah.
Right.
So
whether it's weight loss, a training program, we just came out of January, right? Like, are we still going to the gym? Are we still doing it? Man, I want to bulk up. My kids are telling me that. Dad, it's bulking season. I'm like, I don't even know what that means, but like, you're taking creatine now. Okay. Good for you.
It's costing $50 a month now.
Yes,
Okay,
that's right. Right. But it's so we have a vision even for our own lives to be better. We always want to be better. We always want to improve. But one guy told me, 8 years, he spent 8 years in an addiction, went to work, and he just said, I'm going to worry about that tomorrow. And then he realized 8 years had gone by, broken marriage, broken family. He wasn't around his kids because, the pills, the heroin, it got the best of it. Wow. But you can medicate sometimes for a long period of time on your own. Before the wheels all fall off your car and you're just on the side of the road.
It's highly functioning.
Yeah, highly functioning.
Total addiction. Yeah. So what are volunteer opportunities with Victory Mission?
Yeah, we would love, this is a small little group, but every Monday through Friday at 5:00, we serve a meal. We'd love for people from our community. Those are our individuals on our emergency shelter. During COVID, we turned off our group meal and we started really emphasizing those people that were in a high quality relationship. We want to go deep with each person rather than just touch a lot of people in a kind of a unique way every day. Mm-hmm. So the individuals we walk to, so there's 35 to 40 individuals every day, Monday through Friday, that we feed at 5:00. We'd love to have 2 or 3 people come in. If you're a person that feels comfortable praying over that meal and then welcoming them, that's great. So that's a small group. As we build our new facility in the next year, our new headquarters and new shelter will be open, and there'll be more opportunities for that. We just envision people coming in and do that. So that's a volunteer opportunity. You could be a mentor. You could just bring a meal on a weekend. If you're a church group and you want to just bring over a meal on a Sunday afternoon to serve. There's not hot meals on Saturday and Sunday. We accommodate that with sandwiches and breakfast burritos and things like that our team works out. So, they can go to victorymission.com. They can send an email, info@victorymission.com. We'll respond to you, get you connected with our volunteer coordinator. So there's some steps to get sort of approved in the volunteer space. So to get in there, like every organization, we just, we have some, certain stipulations around locations and proximity to school and other things. So we just want to get to know you a little bit more before you come in.
Do you have special fundraising events you do every year?
Yeah, we've got that's a great question. John, thanks for asking that. So April 30th, we'll have our prayer and coffee. We've got a panelist coming up that will be focused on mental health. Your story nailed it, right? Because there's a mental health component under some of these stories that we see on our corners. So we're going to have a mental health component April 30th. That'll be at the Riff. So they can go to our website, check that out. And then September 24th, we'll have another panelist on entrepreneurship. So we have a chef who came out of our program and he was telling me he is going into individuals' homes now, preparing meals for them. With their family. Like, this is the thing, right? You don't go out to a restaurant, you have a chef come in and do it. And that's been happening for a long time. But Chef Dylan, Wild Foods by Dylan, we have helped incubate his business at Victory Mission. And now he's doing it on his own.
That's awesome.
He's doing classes with the Wolf School. He's doing some meals with Johnny Morris and his team at Finley Farm. Yeah. So I don't know when you arrive, but it's cool to hear his stories. And I'm like, man, you're like more connected than I am. Now, right? That's cool.
Do you keep a list of your successful entrepreneurs that people could actually support? Yeah.
Dylan's our first, and we've got more coming. Our kitchen manager right now has 2 weddings he's going to be catering. That's awesome. All 3 of our kitchen team are graduates of our program. They're all going to Ozark Tech. They're doing a culinary program. that's why I do what I do, because those wins and the same with you guys, when you faithfully walk out that end of life journey or support people, the families thank you. I remember, it worked. I don't know where we are time wise, but I'll tell you this story. We had an individual that passed away when I was at the camp. We transported him, and en route to the hospital, he passed away. He was an older individual coming from a group home, and that family apologized to me for having him, be rushed to the ambulance. But they said, man, what a great story that his last days were fishing at a lake. And then, and just the sweetness of that. And you guys see that out at, I'm a fan of hospice. Like, it is the unsung heroes in our community, because it's a sacred space. It really is. There's no other way to put it. As you help people journey to that next phase of their life. And it's just a sweet thing. So thanks for what you guys are doing.
Well, thank you for being here. I just want to ask couple more small questions, but somebody goes to your website and they want to donate. Yeah. Where does that money go?
Yeah, it goes right to programs. At one point, because we have our supportive services, they can get on, check us out. We do all the Charity Navigator things, and we're more on a Guide Star space, but we're, platinum sealed, because all that really means is you can get out there, you can find our 990, you can see how much money they pay me, right? You could see all these things. We just want to be really transparent with where your money goes, but we're helping individuals. It's going to go right to those people that are staying at our shelter, to the individuals we're empowering with our Victory Market. We didn't even talk about that. We're putting guys back to work. We're getting them ready for the next stage of their journey, and our long-term program for women. A lot of people say, well, you're just a male-only facility. Well, we have that, and that's where we've been, because there are a lot more services for women or women with kids. There's a lot of great safety nets out there. So we added that long-term program because we want to support women leaving addiction. So it's kind of a recovery space, but discipleship, and people leaving prison. So we support them as they walk out their journey to be the best mom, best dad that they can be for the family. So,
wow,
it's fun. I mean, they pay me to do this. It's the best job. And my wife thanks them for paying me to do this. So.
Well, we thank you for the work that you do. Gosh, I can't think of anything that deserves more praise than what you do. And the Victory Mission is such a relic here in this area, and just such a it's so well respected. And so we're so grateful that you're willing to come on and really help bring to the surface, this kind of growing issue of aging homelessness, and, how the general public in this area, it's all hands on deck. We need as much help as we can possibly get, as much in donation, as much as volunteer work, and just awareness, even just to know that those people that are standing on the corner, there's a place for them to go, and a program to not enable them, but to really empower them to make a change when it's the right time.
Yeah, that's exactly right. Well, thanks for having me on.
Absolutely. I just have one quick question.
Sure.
So you're executive director since 2016 at Victory Mission. What you do is very much a calling. It's a ministry. Mm-hmm. What brought you into this line of work?
Yeah. For me, it was, I've been in the nonprofit space, and I could integrate my personal faith with kind of that doing the best work. Right. And so when I found that and I interviewed for it, there were a lot of challenges. We could do a whole nother podcast on, but Victory was in kind of a crisis standpoint. A lot of, organizations ebb and flow, and Victory was kind of at the down in the dumps. And I felt like I've always been that person who takes on a challenge and, won't, if there's a challenge, I'm looking at it. If there's conflict, I'm going to go in it. I'm a move towards that conflict thing. And so I just we just tackled it one thing at a time, and, we're completely out of debt. We're building our shelter. It's, almost 80% funded. So we would, we'd love to have a conversation. If you want to help people, that's the best way. And there's a lot of other great organizations doing this similar work. So, if you're like, man, I don't like what you're saying about that, then find somebody else, but go in and get to know them, because I'm telling you, every nonprofit leader in this community would love for you to poke holes in what they're doing, and they would welcome that challenge. And if they don't, then that's your answer. So come poke holes in what we're doing. Tell us we're not doing it right. And like, let's have that conversation, because that's how we get better as a community. We have to challenge one another in that civic space and say, with dignity, we don't need to be yelling at each other, but just say, hey, we could do this better with this way. Okay, for that group or that thing, yeah, let's talk about that. Let's solve those problems, because that's what we need. Is we need problem solvers. So thanks for asking about that.
Absolutely.
Yeah.
Well, for those of you out there who love to hear what we've talked about with the Victory Mission, want to support it, please like and subscribe to the podcast here. Send this podcast to someone else here in this community, so we can rally support around the Victory Mission. I think they do such amazing work. And Jason, again, thank you so much for being here.
Yeah, thank you. Appreciate the time.
If you enjoyed today's conversation, make sure to like and subscribe so you never miss an episode.
And we'd love to stay connected. Follow us on YouTube, Facebook, and on Instagram at In Good Company Elder Care Podcast.
You can also find us on X, formerly known as Twitter, at IGC Pod, and on TikTok at IGC Elder Care Podcast.
Thanks for tuning in to In Good Company. I'm John Ray, and I've been joined by my amazing co-host, Spencer Ernst. Special thanks to our executive producer, Alex Wallace, for helping bring this show to life. Until next time, take care, and remember, you are always in good company.